Hello, I'm Antony Schaffarczyk and I'm a Principal Social Worker for Birmingham Children's Trust, and I'm here to talk to you today about our practice model of relationship-based practice. When thinking about our practice model and what we wanted from our practice, what we wanted to do, there were two main things really. One was that we place the child at the centre of everything that we do, and the other one is to actually define how relationships are at the centre of all of our practice. And that's how we work with children, to understand what's going on in their lives and think about how we help and protect them. Thinking about how we work with parents and carers to understand again what's going on in their lives, the problems they experience, the impact of that on children and how we can help and support them. Think about how children are in their communities, and communities can be both places of safety where children can be supported, but they can also be places where children, especially as they grow older into adolescence, can be at risk and can experience harm and exploitation, and also to think about our relationships with our partners and other professionals trying to help and support children and families. In thinking about our practice framework and how we move from placing children and young people at the centre of the networks around them to what that actually means in our practice, we first start with child-focused practice in the middle. And that's thinking about our direct work with children to understand what's going on in their lives, to get to know them, and to actually be able to do work directly with them. And it's moving on from that to the quality of our assessments, analysis and decision making to understand children's needs, to think about what's going well in their lives and their family, and what we're worried about and what the risks are. And then to use that to develop purposeful plans to actually really support children and families and to safeguard them and take things forward for them, and also to do the same for children in our care. Stepping out a level from that, we then move to understanding families' challenges and how we can help. So that's thinking about what's going on in adult lives and thinking about the impact on that on children, especially where there can be problems which we know can affect children's safety and well-being. So things like drug and alcohol misuse, domestic violence and mental health problems. This is also about understanding family and carer networks and thinking about how we can help adults as well as children. So it's the skills to talk to parents, carers and other family members about problems, about how we can help them to achieve change. As we move out into the next domain, what we want to do is to introduce contextual safeguarding more and more into our practice, where children and young people can be at risk and experience harm and exploitation in their communities through things like child sexual exploitation, criminal exploitation, gangs and county lines. This is to move from traditional intervention approaches, which tend to be focused on working with families, to focusing more on the places where children and young people can be at risk and experience harm in their communities. What we want to do here is to work with our partners to create safeguarding plans which actually really address risks in places and in community spaces, and which focus on disrupting perpetrators of exploitation as harm, as well as actually then working with communities to build alliances and think about how we can best support them in tackling these issues. What we want to do as we move out again though is to locate all of this work within a framework of relationship-based working. Think about how we work with children, with parents, with carers, with families and with communities. Because what we do has to be done with them, and if it's to be their plans and the changes in their lives for them to be effective. This is also still sometimes about us having challenging conversations and use of good authority, but it's about how we do these things and how we work at all times openly and with respect, empathy and a clear purpose with children and families. So what we have here is an outline of our next steps as we continue to develop our practice model. And what we want to do is to consult with you to see if this is right and to think about what we need to do next or what might be missing. In particular, we want to start by looking at two areas. One is our Social Worker Academy and our learning and development offer to make sure that we're supporting you to have the right knowledge and skills to do relationship-based practice. And secondly, to think about the tools and approaches that actually shape how we do relationship-based practice when we're out there working with children and families.